Congresswoman Noem joined Rosebud tribal officials today at the Indian Health Service Hospital in Rosebud. That's where the emergency room has been closed for the past 6 months. KELO's Kevin Wooster has the latest on the ongoing crisis in reservation health care.
Closed to emergency care in December, the Rosebud Indian Health Service Hospital still operates without an ER or a clear date when it will reopen. And things didn't clear up for Congresswoman Noem during a stop at the hospital today.
The deadline changes. IHS doesn't give us a firm, and today they refused to give us a firm deadline for when the emergency room would reopen. That's frustrating for me.
Tribal officials who met with Noem say it's been frustrating to them for months and cost lives when critical patients had to be rushed to other towns. IHS has hired a new provider for the hospital without a time frame for again offering ER services.
We've been so left out over recent plans to go forward with the opening of the ER that we're not really sure of what's going to happen next.
Noem says pressure by the state's congressional delegation and tribal leaders has already brought change in IHS leadership and begun upgrades at facilities. But more needs to be done fast.
What I got out of today was the disconnect between IHS and the tribe. The relationship is disintegrating.
She plans to introduce legislation soon to make the IHS system more accountable. Her meeting today with tribal leaders was to discuss what they want to see in the bill.
She's very optimistic, so we're more certain that it could be a positive, something that's going to happen.
What comes next, Noem and Bear Shield say, should be full operations of the emergency room here. And they say there's no time to waste. Noem's many lives depend on it.
That's mandated by treaties that we have with these tribes. We're mandated to provide health care to these people, and we're failing.
In Rosebud, Kevin Wooster, KELO News.
KELO News was not allowed on a tour of the hospital. IHS officials gave Noem and the tribal leaders. IHS officials were not available for comment after the tour. Noem and tribal leaders did allow us in during a meeting on health care needs and Noem's pending legislation.